joining us for Your Health, a program that helps you to, well, stay informed and, of course, very important, stay healthy. So joining me today is Caitlin Kirby. She is a public health nurse in the city of Quincy. Caitlin, welcome back.
Thank you for having me, as always.
As always, you're welcome into the studio. Is always a lot of great information to discuss, a lot of topics. I don't think there's ever an end to what we can talk about on the health side. So we certainly welcome you, as I said. And a note for folks that though this is a Quincy show, it's not, or a Quincy-based show, the information that we share goes beyond the city limits.
Yes, most of any topic I do, I always get the information from either the state health department here in Massachusetts or the CDC, Center for Control and Disease. So it's always very universal information. And I always say, if I say something specific to Quincy, reach out to your local Board of Health to see if there are any opportunities in your area.
Because we do play in Yucca, Arizona, too.
Amazing.
Just throwing that out there.
That's I didn't hear the Arizona yet.
That picks up the show. So thank you. All right, so kidney health is today's topic, and I guess we will begin with an overview so folks know, and I know, what to expect. So we will talk about what are your kidneys, the function of the kidneys, chronic kidney disease, risk factors for developing chronic kidney disease, symptoms of chronic kidney disease, also known as CKD.
Yes.
Prevention and resources. So let's start. What are your kidneys?
Yes, so the kidneys, along with your ureters and your bladder, make up your urinary tract. And the kidneys are two bean-shaped organs in your lower back, and there's one on each, your left and right side, on either side of the spine. And they're about the size of your fist. And again, they work in collaboration to excrete waste out of your body.
I think some folks aren't aware that the kidneys are actually located in the back.
Yes, yeah. So that's, it's important to know the location of them, because if you are having like lower back pain, yes, it could be a muscle strain, but it could also be a kidney infection. So that's why it's important to know the location.
Absolutely.
Yeah.
Let's talk about what a healthy kidney does, what a kidney is supposed to do.
Yeah, so these, the kidneys in your body, they filter about half a cup of blood every minute. And what it is filtering, it's taking the blood that's circulating through and it's removing the waste and extra fluid from the body. It is turned into urine and then excreted from your body. The kidneys also remove acid that is produced by your cells in your body and maintain a healthy balance of water, salts, and minerals. So this includes your sodium, calcium, phosphorus, potassium in the blood. And without this balance, your nerves, muscles, and other tissues in your body would not work properly. Especially, like, I always like to think potassium's an easy one to think of. If you have low potassium, you can get muscle cramping. So that just kind of goes to show your nutrients have to be within normal, certain limits within the body. And then these kidneys also make up hormones that help control your blood pressure, make red blood cells, and also keep your bones strong and healthy. So they're very important in your body's everyday functioning.
And I might be jumping ahead here, and scold me if I am, but there are two kidneys, and often you hear that folks can live with one kidney.
Yes, so we'll get into that when we're talking about early stages of chronic kidney disease, but you are correct. Some people might not know they have chronic kidney disease because your kidneys do a good job of at what they do. So if you do have one removed, you can live with one kidney, which can maintain the function of your body.
And often that is a donor organ too.
Yes.
You hear
Yes.
folks that will donate their kidney.
Yes.
Okay, chronic kidney disease, also known as CKD.
Yeah, so chronic kidney disease is a common condition many American adults deal with. Chronic kidney disease means that the kidneys are damaged and can't filter the blood the way that they're supposed to, is all that means. The disease is called chronic because it is a gradual damage over time. It doesn't happen overnight, and you won't wake up and be like, oh, I damaged my kidneys yesterday. It is a gradual thing. And over time, the damage can cause waste to build up in the body, and it can lead to other certain health conditions. I thought it was very interesting to know that in the United States, approximately 35.5 million Americans deal with chronic kidney disease.
And how is that? Well, maybe we're getting there too. I guess we're getting there. So I guess before we talk about diagnosis, let's talk about the risk factors.
Yeah, so as with any condition, it's very important to know your risk factors because, again, certain conditions can increase your risk of developing. So you would be considered at an increased risk for chronic kidney disease if you have diabetes.
And is that one or A or B?
So that would be either. And diabetes is actually the leading cause of chronic kidney disease. And it's typically if they are having high blood sugars or high blood glucose levels that are uncontrolled and unmanaged. So when we get into our prevention at the end, managing your diabetes and your blood sugars is extremely important to keep the health of your kidneys.
And I said A and B. It's actually 1 and 2.
1 and 2, yes.
Okay.
I apologize for not correcting that.
And correct me.
Yeah.
Heart disease.
Heart disease, there would be the link between the kidney disease.
High blood pressure.
Yes. So for high blood pressure and heart disease, we're seeing the link between, because if you're thinking that's your whole vascular system. Sure. It's how your blood is flowing through. So especially where your kidneys work directly with your blood by filtering it, if they're not working properly, it leads to a buildup of those issues. So diabetes, high blood pressure, and heart disease, you want to make sure if you have these conditions or if you have a family history of these conditions. So maybe you don't, but your father got it diagnosed when he was 60 and your grandfather got diagnosed when he was 40. So it's very important to know your risk factors. And that way you can initiate preventative steps earlier.
And there is an age component involved too.
Yeah, so your chances of having kidney disease increases with age. The longer you have diabetes, high blood pressure, or heart disease, the more likely you are that kidney disease will develop. There is also, for individuals who are African Americans, Hispanics, or American Indians, also tend to have a greater risk of developing this in their lifetime.
And is there any particular reason?
So those risk factors also go associated with those groups of individuals. Their genetics can also pre-expose them to high blood pressure and diabetes. So it all goes along with our genetics.
Let's talk about the symptoms. You had said that all of a sudden you just don't have chronic kidney disease,
Yes.
that it develops over time. So what are some of the symptoms that a person may experience?
Yeah, so I split this up into two, so early symptoms, and then I'll go into the advanced symptoms. So early symptoms, and as you had mentioned, you can live with one kidney. So many viewers, if they are home and they have chronic kidney disease, they may wonder why they feel fine. Like they were diagnosed, but their day-to-day life, they're feeling okay. And again, that is because our kidneys have a great capacity to do their job. So if you remove one, the other kidney will just ramp up its demand. It will just work twice as hard. But that just goes to show that you may not know. A lot of people find out by talking to a doctor and getting testing done, because your doctor will look at your risk factors and also your labs to determine your risk level.
So is it like a urine test that could
So it
shed some light, or is it blood workup?
probably, I don't have the whole diagnostic, but blood work would be able to show, like if all your electrolytes and everything's off, it could be a sign that your kidneys aren't working properly. But again, it's very important to keep up with your doctor in your annual checks, because you might not know it. It could be silent at first. And as kidney disease, the longer you have it, the worse it can get. A person may have swelling called edema in especially their lower extremities, your legs, you typically notice.
So is that a fluid buildup?
Yes, it's a fluid buildup. And that it can happen with other diseases as well. So you just want to make sure if you are experiencing edema, check in with your healthcare provider, because that does mean something in your body is not properly functioning. But that edema happens because the kidneys can't get rid of the extra fluid and salt in your body. So that's why it's still in there. Whereas if you had healthy kidneys, it would extract the extra fluid and salts through your urine.
Right, okay.
Yes.
Right, so the fluid is there, it has no place to drain,
Yes.
if you will, and that's why there's the fluid buildup.
Yes. And I did want to say with that edema, of course I said your legs, feet, and ankles, but you may also see it in your hands and your face as well.
Okay.
Yes.
Advanced.
So this would be later stages, of course. People with advanced chronic kidney disease, there's a laundry list, but I'll quickly go through. It would be your chest pain, dry skin, itching or numbness, feeling tired, headaches, increased or decreased urination, so that could go both ways. Loss of appetite, muscle cramps, you thinking of that electrolyte imbalance. Nausea, shortness of breath, trouble sleeping, trouble concentrating, vomiting, and weight loss. And people with chronic kidney disease may also develop anemia, bone disease, and malnutrition, because again, their body can't keep the necessary nutrients it needs.
Interesting. Out of this list, it perplexes me that increased urination is listed.
Yes, so it all depends on that individual, because it could be if they were on a diuretic or if they drink a lot of fluid throughout the day. It all depends on the person, but that's why it's kind of important to know it could be increased or decreased. It's still a concern that you should check in with a doctor for.
And I like the fact that you said check in with a doctor, because now, and for many years prior, people would go onto the web with what they felt with their symptoms and, in a sense, self-diagnose. Now, that
Yes.
can be helpful if you take that info to a physician, but if you
Yes.
don't and you just play doctor yourself, it could be a problem.
It could, just because there's so much information on the internet. I always say use a credible source. So again, the state health department, regardless of what state you're in, the CDC is a great source. Today, all this information is from the Kidney Foundation, so it's kidney.org. So make sure you're looking at a credible source, but again, it can be helpful because it can help you identify what you think may be going on. So it can open a conversation with the doctor to say, I'm experiencing these symptoms. I was reading this. Do you think it could be that? But you want to they have to do a full workup on you. They have to look at your labs. They have to look at your overall health. So it's not one size fits all for these diseases.
So in which case, going and searching on the web without any of that lab work isn't going to help.
Yes, and not for nothing, but if you were to be in a condition, if you were to have your kidneys at risk, you want to check in with a doctor, because down the line, if you have chronic kidney disease, it can lead to losing a kidney. It can lead to needing dialysis. So it's very important. Keep up with your doctor. I know it has been tough, and it's tough to get an appointment in person and all of that, but I do believe that's kind of calming down a little bit post-pandemic. So I will always advocate people keep at least an annual visit with the doctor.
Let's talk about prevention, because if you can prevent this and other illnesses, that I suppose puts you ahead of the game.
Yes. So before I go into those measures, I just want to reinstate that kidney disease often gets worse with time and may lead to kidney failure. If those kidneys fail, you will need dialysis or a kidney transplant to maintain your health. So the sooner you know you have kidney disease, the sooner you can make changes to protect and maintain your health. So preventative options.
And I just want to quickly maybe touch upon what dialysis involves.
So
Is it a flushing of sorts?
I have not worked in that field specifically, so I don't want to say. That would be another topic I could look into.
Right.
I would say.
Right. But it's something that if you went for dialysis, it's a couple times a week potentially.
It can't. Yes. Your doctor would set up your plan and it basically is helping your body excrete the waste.
Right.
So it's helping. It's taking over the function of the kidneys.
Yes.
Is all it is doing.
It's giving it. It's right. It's
Yeah.
it's helping out the normal function of your body.
Yes. And just where I'm a public health nurse, so I don't work specifically with this. I don't want to speak too much on dialysis's behalf.
Absolutely. So prevention tips, keep fit and be active.
Yes, so we always love our prevention. And again, it all goes into keeping your overall health, happy and healthy. So you want to stay fit and active. Every time we mention this, I'm not saying sign up for a marathon. It's little steps of improvement. So if you...
A walk at lunchtime.
Yes, maybe take a 10-minute walk.
There was some place I was reading about 10-minute walks that
Yeah.
they're really beneficial. And for the amount of effort you have to put in, the reward is amazing.
Yes, I've seen studies too, like if you would walk after a meal, if you take a 10-minute walk after a meal, it does influence your blood sugar levels. So staying active is extremely important for overall health. That goes along with a healthy diet. You want to make sure you're getting your vitamins and minerals. And a lot of times, we do need supplements, like over-the-counter vitamins. But again, it's very dependent on that person, on what conditions they may have. So if you don't know what's right for you, talk to your doctor, and they can do lab work to see if you are like low in vitamin D or potassium.
Which in this section of the country is common. It's common for folks to be low on vitamin D because a lot of that can come from the sun.
The sun, yes. So yes, New England, we have a lot of cloudy days and pretty long winters. But check in with your doctor because the dosage depends on you specifically. Not always. If you're an average healthy adult, you could look at the generalized doses. But check in with a doctor or even a pharmacist because they can look at what you're on and what may interact. Yes.
Blood sugar?
Blood sugar, so that goes along with managing your diabetes. And that also goes with your blood pressure. If you have hypertension, make sure you're sticking to your medical regimen. And making sure that your blood pressure is not spiking too high. Again, both of those are controlled with collaboration with your doctor. You would want to take an appropriate fluid intake.
Which is?
So we typically like to say 8 glasses of water a day.
And that might seem daunting to folks.
It does sound daunting. Nowadays, the water bottle trend is, unfortunately, I have fallen victim to it. My husband tells me to stop buying cups. I keep bringing a new cup home.
Oh, and they have like straw covers, and there's all kinds of ways to, I guess, decorate.
Yes. Oh, I have a hot pink cup with purple and yellow at the moment.
So it can
I love
be fun.
it.
Absolutely.
But it's nice because it's like a comfort water bottle, but have it with you and sip on it throughout the day.
Right, so we're not saying these 8 glasses of water that you gulp these 8 glasses of water.
Yes.
We're saying drink that amount over the course of a day.
Yes. And again, like if you may be on a diuretic and your doctor could have you on a fluid restriction depending on other diagnosis. So check in with that doctor, but typically 8 glasses of water a day is a good thing to put in your mind to at least try to reach that goal.
Sure. Don't smoke.
Always quit smoking. Overall, that will increase your blood pressure, your whole vascular system. So the body is a system. Everything works together. So stopping smoking can only improve your health. And then next we have don't take over-the-counter anti-inflammatory or painkiller regularly. So that's like your Tylenol, your ibuprofen, your naproxen. You just want to make sure you're not overtaking that because that can be really hard on your kidneys and your liver to flush out.
That's a good point, because someone might have a discomfort and instead of going to the doctor, take the over-the-counter anti-inflammatory, but not realize that they're taking that every day.
Yeah.
In other words, not realize they're taking it that often, whereas if they took it the day, let's say they felt the symptom, but then that same day or the next day or the following day put a call into the physician, because again, like you said, you should get down to the bottom of it. It's not helpful to be masking this pain.
Yes. And if it's chronic, like if it's 2 days and you think you maybe pulled your back,
Let it go.
And you don't think you have other risk factors, say it was like a specific thing, you were lifting something and you hurt your back, you could take Tylenol, but if it's lasting and that pain's increasing or
So
you have
weeks go
nausea,
by.
vomiting, check in with your doctor because that is very important to make sure you handle that.
Yeah, they're not meant to live on.
Yeah, you're not masking. And it's tough because they're over the counter. So people think like, oh, it's not that serious. It's still a medication that's affecting your body and your body has to flush out of its system. So it still does affect your organs. So make sure you're taking those appropriately and by the guidelines. And then lastly, we just have get your kidney function checked. If you have more than one high risk factor. Typically, if you do have those risk factors and you're managing them, you would be doing so through a doctor. They should already be monitoring your kidney health, which is lovely. But it's just for the viewer who maybe never thought of this, just make sure you're sticking with annual doctor's visits.
And as we close, you had referenced the National Kidney Foundation.
Yes, so that's where I got the information for today's presentation. That National Kidney Foundation, there are tons of links. There's nutrition guidelines, a lot of helpful information for either patients or their families who's trying to help somebody change lifestyle habits to manage. So I do believe that's a great website to visit for more information.
Very good. A lot of information in this half hour, though, so thank you so much for providing that.
Of course.
And I want to thank my floor director, James Haley, who has helped out on this program. Thank you, James. And I want to thank you at home for watching, and please remember to support the local access center in the community in which you reside. Stay healthy.